أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. I welcome you all to this international webinar on COVID-19 crisis, facing the crisis by stepping into the future. Before we go on, I'll request Tariq Saab to kindly put up the recitation of the Holy Quran.
بسم الله الرحمن الرحيم. القارعة ما القارعة وما أدراك ما القارعة يوم يكون الناس كالفراش المبثوث وتكون الجبال كالعهن المنفوش فأما من ثقلت موازينه فهو في عيشة راضية وأما من خفت موازينه فأمه هاوية وما أدراك ما هي نار حامية.
Of requesting the worthy Vice Chancellor, Professor Khalid Masood, for his welcome address. I'd like to mention here that King Edward Medical University only last week held a webinar on COVID-19 at a local level. And it was Professor Khalid Masood Gonda's brainchild to hold another seminar where we would have international speakers.
On behalf of King Edward Medical University, Lahore, I welcome the Honorable Chief Guest of today's international webinar, Honorable Shafqat Mahmood, Federal Minister for Education and Professional Training. Our guest of honor, Honorable Minister for Health, Professor Dr. Yasmin Rashid, Chairman, Punjab Higher Education Commission, Professor Dr. Fazal Ahmed Khalid, Focal Person of Prime Minister of Islamic Republic of Pakistan for Corona, Dr. Faisal Sultan, Honorable international speakers from USA, UK, Australia, Saudi Arabia, and eminent national speakers. King Edward Medical University, by the grace of Allah Almighty, have completed 160 years of excellence in the medical education. King Edward Medical University faculty members are practically frontline soldiers in the current pandemic of COVID-19. Following the vision of the government and under the dynamic leadership of our energetic health minister, Professor Dr. Yasmin Rashid, our faculty member, young doctor, nurses, and paramedics are providing quality health services to COVID patients in isolation ward, high dependency unit, and intensive care of its attached 7 hospitals, particularly the largest one, the KEMU Hospital, Lahore. Our telemedicine department with 3 sections, tele-OPD, tele-psychiatry, and tele-corona help desk have extended consultative service to thousands of patients throughout the country and even outside Pakistan. Our faculty members have played a pivotal role in the formulation of the guideline as the member of Corona Expert Advisory Committee of Punjab. King Edward Medical University faculty is also facilitating and supervising training courses within the institution and throughout the province. As per instruction of Higher Education Commission Punjab and Pakistan, online teaching and virtual training through campus management system is a regular feature of King Edward Medical University. COVID research is our top priority, and currently 29 research projects they are going on. Every challenge brings some opportunity, and during current COVID pandemic, we have felt the need of adequate trained expert in the infectious disease and intensive care. Inshallah, King Edward Medical University is going to establish the Department of Infectious Disease and Telemedicine on permanent basis. And as the long-term years, we will establish the Institute of Infectious Disease at our new campus, Murid Ke Narowal Road. Honorable Chief Guest, I conclude by thanking Your kind honor, Mr. Shafkat Mahmood, and the guest of honor, Professor Dr. Yasmin Rashid, all the honorable speaker for gracing the King Edward Medical University International Webinar with their kind presence. Thank you very much.
यकीन मुकम अमल पे हम मोहब्बत फातिह आलम जहाद जिंदगानी में है मर्दों की शमशीर. This is what lies true for all the dedicated frontline soldiers and fighters who are fighting for this crisis and have lost their lives and their lives. First of all, I invite our Honorable Chief Guest, Shaukat Mahmood Sahab, Federal Minister for Education, Chief Guest of today's seminar. He has always blessed King Edward Medical University with his shafqat, and we look forward to his encouragement and support. I'll request her for a few words of wisdom.
Professor Khalid Masood Gondal Sahab, Dr. Yasmin Sahiba, Professor Bilkis Shabir Sahiba, Fazal Khalid Sahab, Dr. Faisal. I find myself a complete misfit in this august company where we have such eminent doctors and such people who have excelled so much in their medical profession, whereas I, of course, have little to do with medical profession except as a patient. But what I have been seeing in the last few months and over the years is the amount of work, the effort, dedication of our doctors and our both male and female doctors. We शेयर पढ़ा प्रोफेसर बिल्किस साहबा ने, तो उसमें मर्दों की शमशीरों की बात थी. यहाँ तो हमारी खवातीन जो हैं वो सबसे आगे हैं. So I really take my hat off to all the doctors, the nurses, the people who are at the front line of this fighting this terrible disease, this pandemic, which has come and challenged our health system. We have in the shape of some of the people present here today, outstanding professionals. Dr. Yasmin Sahiba, who's a colleague also, and we have worked together for many years, has tremendous amount of energy, dedication, and ability to implement all the right steps, and I've seen that over the years. Professor Khalid Masood Saab, I've met recently, but I've been deeply impressed by his commitment to the university and the commitment to the medical profession. Professor Bilkis Shabir Sahiba, I've been actually lately in touch with her because of a number of challenges on the medical side in our own family, and she has been an outstanding professional. Really, we are Dr. Faisal, whom I don't see on the screen, but I'm sure is there, is obviously a name that we all revere, a name that we all look up to. So we have great leadership in our medical profession and in combating this challenge. It's an unprecedented challenge. It's a kind of challenge that we've never faced before of this magnitude. There have been other health crises, but this is really far beyond any kind of health crisis that we've faced, particularly because there is no vaccine, there is no cure. And at the best, what we can do is manage the crisis. And in the last 10 days, I've learned a great deal about this illness. And I feel that our doctors are doing an outstanding job of managing the crisis. And that is why so far, Allah kare aisa hi ho, ke our death rate is much lower compared to many other countries. When you compare to the degree of infection that we have, I think the infection is very widespread and is galloping ahead. But our patients who are the mortality rate relatively is still low, and I really, really hope that it remains low. So this webinar is very, very important for all of us to share our experiences and to compare notes and see what works, what doesn't work. Every day we keep hearing new things. Yesterday in the CNN, we heard about the impact of some acid reflux medicine, which had a good impact on some patients. We've heard about other medicines. We have challenges also of supply, because I believe some of the injections are not available anymore. So these are variety of challenges that we face. For managers and administrators, obviously the greatest challenge is that we are able to provide the medical assistance to all of those who need it. So thank you very much again for inviting me to be your guest on this very important webinar. And I may not understand everything that you say, but I'll try and follow it. Thank you very much again.
I request Professor Yasmin Rashid Saiba for a few words to guide us and few words of wisdom.
Thank you very much, Professor Bilkis. And I'm extremely grateful to Khalid Masood Gondal Saab for organizing this very important webinar. And I'm very happy to see that, mashallah, we have got a lot of international participation. And again, I'm extremely grateful to Mr. Shafkat Mahmood and Faisal Sultan for being here with us together. We do understand that all of us, not only in Pakistan, all over the world, we are going through this very dark time where we are facing a huge pandemic, which is constantly evolving. And every day you see something new coming in regarding the treatment, regarding the mutation of viruses, regarding how can we deal and how can we manage it. And today in Pakistan, we are facing a huge challenge. However, inshallah, as things are developing, we are very lucky as compared to any other country in the world that our mortality our mortality rate comparatively is much lower than mortality rate of other countries. I'm sure there must be some reason that Southeast Asia seems to have this comparatively low mortality rate. We're still not very sure why. However, I think God has been very kind to us, because with our very delicate sort of a health care system, this sort of pandemic would have really taken the toll up till now. So we're at the moment sitting in Lahore, and King Edward Medical University, particularly Mayo Hospital, has been our bastion, or it should be said, it is our main fortress, which is really helping us to combat this virus. Lahore is an epicenter, and the control the control room has been established in Mayo Hospital, and we have got one of the most robust telecenters working in King Edward Medical University. So like always, King Edward Medical University and Mayo Hospital are leading the whole show, and hopefully, inshallah, all of us working together and working very hard and diligently, I'm very sure that we'll inshallah overcome this pandemic. What's extremely important is sharing experience, because naturally every country would have its own experience. So sharing that experience would really be very beneficial for all of us. So I'd like you to please continue on the webinar. We are all here with you, hopefully listening to some new wisdom coming in and helping us to fight against this pandemic. And inshallah, with all your help, I'm sure we'll come through this with flying colors. Thank you very much.
I request Dr. Fazal Ahmed Ali Sahab for a few words.
Thank you very much, Madam. And Bismillah ar-Rahman ar-Rahim, Honorable Chief Guest, Mr. Shafkat Mahmood Saab, Federal Minister for Education, Minister for Health, Dr. Yasmin Rashid Saiba, Vice Chancellor, King Edward Medical University, Khalid Masood Gondal Saab, Dr. Faisal Sultan, Coordinator and Focal Person for PM Task Force, distinguished guests, doctors, foreign delegates on this webinar, Ladies and gentlemen, Assalamu alaikum and good evening. Thank you so very much, Dr. Khalid Masood Gondal, for organizing this very important and it's very critical, not only to look at the challenges, but also the opportunities that we may have as a result of this pandemic. But let me congratulate and pay a big salute to all of you in the medical department, in health departments, to doctors, to paramedical staff and the leadership, and the government departments for the frontline soldiers and contributing in this pandemic. Ladies and gentlemen, a lot of universities and a lot of organizations are working on vaccines, and let's pray that this will be discovered and then concluded soon. And we pray to God that this pandemic will be over soon. But let me say that while we are dealing with this pandemic, over the last few months, it has resulted into a big change, not only in the educational institution, but the whole look at the way we have been working in the past. And that has resulted into the solutions adopting the modern technologies. And then from that point of view, ICT is very important and critical. Most of the universities in Pakistan have now adopted online educations. Schools and colleges are also partially contributing for online education. This was a big challenge in the beginning, but there is a lot of now comfort and things have been sorted out in joint collaboration with Higher Education Commission Islamabad, with regulators and at the provincial level, various departments. But one of the big challenges that we are facing, we were thinking that this thing would be over soon, and then the universities and institutions will be open. But it's not now possible. And now the challenge that we are facing, apart from access and internet and online teaching learning process, assessment is very important and critical. And taking exam online is maybe possible in some of the programs, but in professional education, particularly in engineering and also in medical sciences, this is a big challenge where there's a practical requirement, there's a project, there is a design, there's a lab work, and that we have to see that how we can bring online learning with the blending mode of learning. From that perspective, I would request the Honorable Minister for Education, as the budget is going to be announced by the government, we have to make emphasis that the government put a lot of at least funds or priority to online education, capacity building, learning management system, software development, so that our institutions, some are having the minimum requirement for online readiness, but most of the universities are not actually having that kind of facility available. So we have to make sure that how we can come up with the indigenous solutions from that perspective. In addition to that, with the modern technologies and the emerging field with artificial intelligence and with the data science, and also with the biomedical engineering, these are the disruptive technologies which can take you to the next level of development. And I think we need to focus on that. There's a big now realization, and most of the universities in Punjab and overall in the country are contributing, helping each other, not only in training, webinars, and also bringing their expertise to the other institutions so that they can also learn from the good practices. I would like to congratulate the Vice Chancellor for this telemedicine and telepsychiatric facilities that have been extended. But biomedical engineering, ladies and gentlemen, is one of the most important and critical elements. The world is moving towards integrated approach and moving away from the segmented engineering, medical, and other fields of sciences. So we have that now, even in medical sciences, it's very difficult to run a modern facility without having the technological support which is needed, whether it is engineering, whether it is the technician, not only the equipment, which is very accurate and high-tech and sophisticated. So their development, their fabrication, but then at the same time, we have to see that how we can impart training. And I think King Edward Medical University has taken a lead, and I would like to congratulate them. And from Pakistan Engineering Council, I would also like to mention that they have contributed with all the stakeholders and organizations in the design and in the final stage of local ventilators to be developed. The design has been now finalized by the DRAP, and hope that this would be soon going into prototype, into manufacturing. But at the same time, it has resulted into many other opportunities in public and private sectors, from PPE to mask and so many other facilities. in the world, there is a model. We all know that that indigenization of technology is the need hour, and I think that we have to focus. And this crisis has allowed us to think and analyze and see how best we can deliver and contribute and coordinate with all institutions. Particularly, our universities have been focusing in the past on research which was related to lab scale work. But now is the need that this lab scale research has to be translated into the technology driven products, devices, softwares, equipment, so that we can not only help in our country but also bring it into the export, which is the government policy and focus at the moment. So thank you so very much, and I'm sure that this webinar and Punjab Higher Education will support you on your initiatives in your research in COVID-19 and contribute in the best possible manner. Thank you so very much.
Thank you so much for your. Now we'll start with the actual subject, the COVID-19, and for that we'll start with Dr. Faisal Sultan Sahib, who's not only a Cambodian, but also he is a consultant in infectious diseases, working at Sheikh Shaukat Khanum Memorial Hospital. He's member of Prime Minister Task Force on Health and focal person for Corona. Sir, you representing the Prime Minister, what is your vision and what is the vision of the Prime Minister regarding this disease in Pakistan?
Assalamu alaikum. Thank you very much. The vision, of course, is very simple. We need to ensure that we can keep our rates of infection as low as possible while still allowing our society to function. At the same time, to ensure that our health system, which is currently under stress, is able to take this stress, is able to come out with flying colors and with the best possible outcomes. Now, these are vision objectives, but let's go back to what we started with and what the challenges have been. And I think that will give us some idea of where we are and where we ought to go. In our devolved system, one of the first challenges was that for data-driven decision-making, you required accurate data that flowed easily between the provinces, between the districts, all the way up to the national level for a good, clear view of what was going on, and therefore for decisions to be made which were data-driven rather than just reactionary. For this, a lot of work was done to connect initially just the diagnostic labs and subsequently a whole lot more information that I'll talk about in a little bit. To create this connectivity, the government had to use some existing databases that existed, as well as some collection systems, data collection systems that existed. So namely, this was the NEOC, which is the polio program, and its data collection was used to piggyback this information on top so that at least a central view could be done. This was crucial because without this, as I mentioned, you really can't know what is going on. The other important thing that be a coherence of response and connectivity. And this coherence was brought about by the NCOC, which is essentially the command center for Corona, which is chaired by the federal minister, Mr. Asad Umar, and supported by a number of ministers around the table, as well as by myself, and of course by Dr. Zafar Mirza, who's a key person for this in view of the subject. We are also very heavily supported by the military establishment to make sure that all the logistic and administrative and coordination issues are taken care of. So beyond the coherence, one of the first steps that had to be done was to actually enhance the capacity in a number of domains. And the first of which was the ability to test. Some of you may recall that we started out with only 4 laboratories. And this has been ramped. We're done in 24 hours the last time that we are talking about. And so this tremendous ramp up of the capacity to test has contributed us in providing us with visibility as to what is going on, as well as with good, accurate diagnostics for clinical care. Now, there were key organizations that made this happen. That included the NIH, along with cooperation from a number of public sector and private sector laboratories all across the country, all across 5 provinces and the AJK. Beyond laboratories, the next challenge that was obvious and immediate was to ensure that a steady and reliable supply of protective equipment was not only mapped, but also delivered. And despite some initial hiccups, this was achieved. And I think by and large, even from anecdotal evidence, but also from fairly certain numbers, we are happier, much happier with the situation of the provision of personal protective equipment than we were when this whole epidemic started out, and when the initial fear and panic started to set in, understandably, within our healthcare profession, especially with frontline workers. The other additional capabilities that have had to be created, of course, have got to do with the provision of oxygenation in the system to people who are unwell, and certainly the availability of ventilators and the deployment of ventilators, which is not easy given that everybody in the world all at once wanted the one same thing. So if nothing else, this has highlighted the huge gap that we have had, and now we've had to fix this in a hurry, something that hadn't been fixed in decades, but we now need to fix this not only in provincial system, of course, devolved system, the flow of information from the institutions, for example, as to where there were beds and ventilators and so on, onwards into a central dashboard, and then communicating that down to decision makers, both at the strategic level as well as at the operational level, was required. This has been put together. There is a new app which was launched yesterday, and I should be available on the App Store within a few days, to allow even the general public to look at it, but there is dashboard access to the emergency services like 1122. Now, these, you would imagine, in many countries are a given, and they're nobody's trying to build them as you go along. It's a little bit like building a plane while you're flying, but that unfortunately is what we've had to do given what was there on the ground. Now, where are we today? Where we are is we're about to, in the next few days, perhaps tip over the 100,000 marks for actual detected diagnosed cases. And of course, that's a sad but important landmark. And the last 24 hours saw the highest number of deaths that we've seen in 24 hours, which was 97 deaths. Each death is a tragedy and a loss, and 97 is too many in one day. Nevertheless, as was mentioned, when you compare this across countries, the per million death rate, or whether you calculate even an absolute number, we have been relatively lucky so far. But I must stress that this is not over yet. People keep asking me, where is the peak and when will there be a peak? And I keep always reminding that the peak is always visible when it's gone. It's seen in the rear view mirror. And so therefore, our most important challenge at this time is to ensure that we remain prepared for tough days ahead, as well as to ensure that we are properly equipped for dealing with this. Now, related to this is a very important phenomenon that is going on right now, which is stress on our healthcare system and our healthcare workers. All 4 major cities have a difficulty in this matter. While we look at total numbers, we have capacity available, but as you can imagine, capacity is never uniformly available or uniformly scattered or distributed. And therefore, in such situations, you are bound to run out of capacity in one domain or one area or one city, especially in larger cities, especially in the larger and more preferred hospitals. So this uneven and distribution issue is a major challenge right now. And I think this is what we need to tackle and deal with: better information, better coordination, and development and enhancement of our capability for oxygenation and, of course, ventilation on the fly. I can tell you from my visit yesterday in Karachi that one of the key issues is that there isn't so much stress on vents so much than on the need for oxygen, especially high flow oxygen capabilities. And therefore, this has to be retooled and re-engineered in a very fast way. I would say that despite the stress on the health system and on our healthcare workers, it is my belief that because all the efforts being put in by all the provinces, and I have to tell you this, wherever I've touched and connected, I've seen people with high commitment. Dr. Yasmin is here. I think she's spending more hours than we can believe even, and that a person can put in. But this kind of commitment is just unbelievable, and I see this in many other places. And so I feel that when we look back and when this is over, inshallah, we will be able to say that this was our finest hour. I borrow this from Winston Churchill, but that this was our finest hour in a time of great stress. And not only that we come out through it well, but then we have this enormous opportunity. We must not let this opportunity go of improving and connecting our healthcare system all across the entire spectrum. And I think there is great desire for this. I think political decision makers, if never before, perhaps globally, even today, they for the first time, perhaps across the world, people understand the importance of investing in healthcare systems. About going further beyond what I've said, I think there are two areas that we need to stress on. One, of course, is capacity and innovation that was already mentioned. I won't stress on that too much because it's already covered. But one important thing going further, no matter how much we enhance our capability and capacity, it will get outrun if we do not continue to try to keep this epidemic in control. We understand and realize that a broad, complete shutdown may not be possible simply because of the impacts it has on people's lives, even healthcare and economy and so on. But it is very crucial for us to remember that compliance with measures that help us prevent the spread remains the crucial pivot around which this will become a success story or not. And I can assure you that we are not done yet. We do believe that not only that this compliance has to be done by individuals, but some level of compliance needs to be enforced through people who are in charge of areas, whether this is shops, whether this is factories, whether this is institutions. I think all of those who are in charge of areas need to also take some responsibility to prevent the spread of this. It cannot be taken lightly. As part of the prevention of spread or the reduction in numbers, one of the strategies has been what became labeled as TTQ, which was test, trace, and quarantine. I can tell you with some satisfaction that of the tests that we do, a greater number now, ever greater number than before, is now tested on the contact tracing, which is an extremely important element in trying to slow the spread of the disease. Nearly of data coming in from the last 2 days, nearly a third of all tests that are being done not for diagnostic tests, but for contact tracing. That is the true strength of the system and will actually prevent further spread. The other bit that I will quickly touch on is the ability to really know where to introduce stricter measures, and that is really hotspot generation. There is work in progress. There is already hotspots that are being detected through manual systems. There are at any given time dozens and dozens of areas within the country, all across the country, that are that have a more restrictive regime in place, essentially a local lockdown. But I think we are in the midst of trying to automate this to a level where this will become easier to do without it being tedious. I would really stop here, and I think that this is a crucial juncture for us as a country and as a profession. But I think there are opportunities out of here, which if we take further and we make use of, I think we can come out of it stronger and better and with the least amount of damage. I do realize every death is a travesty and as a disaster, but I think if we are able to come out of it relatively unscathed, then at least we would have some satisfaction that we put in our efforts where they matter. I'm grateful to you for inviting me and for listening to me. Thank you very much.